Live from New Hampshire, it's time for the Science Cafe!
Learn about the latest technologic innovations today.
And you don't have to pay.
Expert panels with advanced degrees are sure to satisfy your curiosity.
Did we mention it's free?
And if you think you'll find a better time than this, then come on down and test your hypothesis. Cause you're gonna learn a lot if you wanna stay down at the Science Cafe.
Hello and welcome to the very first virtual Science Cafe New Hampshire, where the beers cost less, but the service varies. And thanks to the reach of Facebook, it's also the first global Science Cafe as well. So take a minute while I'm talking to share this event and invite your friends to join, no matter where they are. My name is Dan Marchek, and I'm your host for this evening. Since 2011, Science Cafe New Hampshire has brought panels and people together to hash out the importance of science to a wide range of topics, in the hopes that science will help clarify our understanding and create a more informed and prepared community. For more information, you can visit our website at www.sciencecafenh.org. Our last session before the coronavirus shutdown was on March 11th, on the topic of science fiction. Little did we know that we were actually entering a real-world science fiction nightmare that would fundamentally change our lives in so many ways. As Darwin noted, it's not the strongest that survive, but those who can best adapt. So Science Cafe is restarting tonight by hosting a distinguished panel who are here to help address the elephant in everyone's room: how to understand the new coronavirus as a disease, how to sort through the deluge of information and misinformation that assaults us daily, and how to use that information to help us responsibly and safely move closer to a normal existence. But before we start, the folks at Science Cafe want to thank all of you for being here. We hope you and yours are safe and healthy and you remain that way. We also want to thank Macris Restaurant in Concord and the Riverwalk Cafe in Nashua for hosting Science Cafe New Hampshire, and we look forward to the day when we can return to physical gatherings. Tonight, our first virtual Science Cafe gives us a chance to try new things and introduce new formats and new people. Some things will be the same, some different. Things that stay the same are giving you direct access to experts who are here to listen and answer your questions. We're recording the session for rebroadcast and hope you help us share it even after it's over. And of course, no politics. The biggest difference is that we are not together. We have a new format and new tools that enable us to break some of our old rules. A virtual audience is a necessity, but virtual panelists are a dream we've had for years. We've even decided to support AV4 GASP PowerPoint slides. Yes, we may have lost our way, but let's give it a try. You're watching this via Facebook Live and can ask questions by typing them into the comments. Science Cafe staff will vet the questions and ask the panelists as many as possible. So please be patient and realize we will likely not get to every one. On the other hand, the virtual world opens up local conversations like Science Cafe to be bigger, engage a larger audience, and impact more people's thoughts. We're truly excited by this opportunity to serve our community in new ways, and thank you for being part of this experiment. As always, we're interested in feedback, so please drop us a line with your thoughts. Tonight's panel includes Bobbie Bagley, Director of Public Health for the City of Nashua, Angela Consentino, City Epidemiologist, and Jenn Alford-Teaster, a research scientist at the Geisel School of Medicine. The moderator for tonight's panel, making his world premiere in this role, is Mr. Rick Irving, a longtime Science Cafe team member and lifelong geek. So please enjoy the session and submit your questions via Facebook comments. Thanks again for being here, and let's have fun. Now here's Rick.
Hi, Dan. Thank you for that elegant introduction. So the Science Cafe is very simple, folks. What we do is we'll have the panel give us a little bit about their background, and then it's going to be driven completely by the audience. So from then on, the rest of the session will be questions and answers. So as Dan said, if you have some questions, go ahead and put them in there, and then we'll give them out to the panel as we go along. So we'll have them introduce themselves, tell us a little bit about themselves and their expertise in the public health arena. And we'll do it in the order that Dan just introduced them. Bobbie first, then Angela, then Jenn. So if Bobbie, if you could go first and tell us a little about yourself and your background.
Yes, good evening, Rick, and thank you for having me on this evening. My name is Bobbie Bagley, and I am currently the Director for the Division of Public Health and Community Services for the City of Nashua. My experience in public health has spanned over the past 23 years. And in fact, my first job right out of nursing school was as a public health nurse for the City of Nashua, where I worked for a number of years as the HIV, STD, immunization, and TB coordinator. I then went back to graduate school to get my master's in public health, where my concentration of focus was on disease prevention, health promotion, and behavioral health. And since then, I've had the opportunity to work for local government for the city of Nashua. I've also worked in the city of Manchester as a program director for a number of programs that were funded by the state and some other federal organizations. I had the opportunity to also work as an instructor for Riviera University for a number of years for the nursing school, and then also became the first director of their public health program. And then I was invited to come back to the city of Nashua in the role of the director about 4 years ago. And that invitation was extended during the opioid crisis, when we really needed to think about a systems approach for how we were going to address the opioid epidemic. And this is a field, a profession for me that I've always enjoyed the marriage between nursing and public health, because it's such a holistic approach to how to deal with and serve the public. And so my nursing background lends a nice lens to public health as well, because of the clinical aspect of it. And I'm enjoying the work that I do. We are in a particular pandemic crisis event that really allows for all of my nursing skills and all of my public health skills to be brought to the forefront in leadership as we address this crisis. So thank you for having me on board, and I'm looking forward to our conversation this evening.
Great, thank you. Angela, if you could go next. I must admit I had to look up epidemiology before the call today, and it was fascinating. So if you could tell us a little bit about yourself, and then also explain what epidemiology is, and as an epidemiologist, what it is that you do with relation to the coronavirus.
Yeah, sure. So I'm Angela, epidemiologist at the City of Nashua Division of Public Health. I've been the epidemiologist in Nashua for about 2.5 years now. And before that, I was a research assistant at Massachusetts Department of Public Health in their Occupational Safety and Health program. And then before that, I was getting my graduate degree from UMass Lowell in epidemiology. So my role as epidemiologist varies on what I do. So right now with the COVID epidemic, I'm mainly focused on that. So I do our data updates. I look at all of our case information. I organize the case information, and then I create graphs and charts to show people what's going on. For example, we're working on occupation data for all our cases, race and ethnicity data for all our cases, things like that. And then when I'm not working on COVID, we have several different projects that I work on. So right now we're actually in the middle of our Community Health Assessment 2020. So that's where we assess the general health of the community through data. And we do that through research. So we have a survey out. We wanted to do in-person sort of qualitative data collection, but we weren't able to because of COVID. So now we have a survey. And then, so I do things like that. We have our community conversation research project, which was interviews with people who are actively using substances or people in recovery. So I do a lot of data collection, data analysis, things like that. And yeah, so I really enjoy it. I got into epidemiology because I like statistics and I like people. So this is a perfect fit for me.
Great. Jenn, how about you, your background and what you're up to at the Dartmouth University School of Medicine?
Thanks. Hi, I'm Jenn Alford-Teaster. I'm a senior scientist in the Geisel School of Medicine, specifically in the biomedical data science division. I have a background in applied geography with a specialty in geographic information science. I apply the use of maps to study the form and function of communities and how people access and utilize healthcare services. I have also a master's degree in public health from the University of New Hampshire. I have, over the years, worked in emergency management, first working at a fire department for a couple of years as their mapping specialist, and then moving into the Dartmouth New England Center for Emergency Preparedness, working with communities across Vermont and New Hampshire to develop medical surge mass care plans. Some of those plans now being put to use in the state of New Hampshire in response to COVID. I also, in my current role, am co-faculty on an advanced healthcare services class where I've been working with master's level students, often physicians and surgeons, to teach them about the use of mapping and understanding sort of the geographic impact of COVID as it spreads. I spend a lot of my work time working across a variety of topics. One of which I think will be relevant to this context is the use of health communication, health information, how people consume information, particularly in New Hampshire and Vermont, and how to parse between misinformation and what some of the current tools are in research now with COVID are being studied and understood, because there's been a proliferation of funding directed towards understanding the use of information in tracking and understanding how people make sense of the guidance that's been provided. We in particular have a newly funded research project to explore and the use of telemedicine and the proliferation of telemedicine in the era of COVID, with the expectation that this will be something that we can apply in other areas of chronic disease outside of a pandemic situation, specifically to cancer care, because I also have a co-appointment in the Norse Cotton Cancer Center. So I'm really excited to be here, looking forward to sharing the insights that I know and to the great questions. So thanks for having me.
Great, thank you, Jenn. So we have an outstanding panel here again. Thank you in advance again for your time. And let's get right on to the first question. The common recommendation for social distancing today is 6 feet. Is there a scientific validation for that number? And what factors impact that number, such as, being in outdoors and winds, and how does that change things?
I can start off and take that. So we know that social distancing works because COVID-19 respiratory droplets are fairly large and fairly heavy and float to the ground within about 1 minute after a person coughs or sneezes. So that 6-foot radius protects others from breathing in those respiratory droplets while they're briefly suspended in the air for that 1 minute. So the idea is that when a person coughs or sneezes with COVID-19, the respiratory droplets are not going to travel further than that 6-foot radius. So it's like a little 6-foot bubble around the person before those drop to the ground. And then in regards to outdoors and confined spaces, so yes, confined spaces, being outdoors would protect you more than being in a confined space. And yeah, wind could possibly have an impact, but the droplets are large and heavy, so they will just float to the ground within 1 minute.
Can I augment that answer? Is that
sure?
Okay? So the question was, what are the scientific validations for this number? There are some, and it's generalized. Also, it's commonly understood that if you're doing a behavior that causes you to expel those droplets at a faster rate, like sneezing, that distance actually expands. Also, talking really loudly or vigorously, of course, exercising. So there is a range, but 6 seems to be in regular everyday interactions to be the distance at which you could minimize the ability to consume through the air those droplets and micro droplets. of course, given some confined spaces, there is an understanding that there's a potential for those droplets to hang in the air, for those micro droplets to hang in the air for several hours. So having a well ventilated space, making sure that the air is moving, is one way to also limit your prolonged exposure, because prolonged exposure would make it more likely that you develop an infection.
Yeah, and if I could just add on to that, the beauty of being outdoors is that you're not in a confined space or in an area where you're breathing in recirculated air, and so it reduces the risk factors for exposure when you are outdoors. That social distancing is really important because of how droplets travel, not just when we cough or when we sneeze, but also when we sing. And as it has already been mentioned, when we speak, sort of forcefully, you've got those droplets that really can project, and they're invisible, so you can't see them. And so that 6 feet range of distance allows for us to safely be in the presence of one another and reduce that risk of exposure to each other's droplets while we're out in the public and in spaces where people are gathered together.
Excellent, great, thank you. So the next question comes from Adele. Is there a contact tracing program going on in New Hampshire? And if so, what is the data saying about the circumstances where the virus is contracted? And what about nationally and globally as well?
Yes, so there is contact tracing going on in New Hampshire. So there's 3 different things that happen in the state of New Hampshire. So where you have the Nashua Health Department, the Manchester Health Department, and then the State Health Department. So in Nashua, we take all of the Nashua cases and we go through and we do a disease investigation and then contact tracing for each and every case. So in the state of New Hampshire, I think the data right now is saying that about 30% of cases are transmitted through community-based transmission, which means that there was kind of an unknown exposure and the person wasn't sure where they got it from. And then after that, I think the second leading cause of exposure is contact to a direct case. And then after that, travel. So those are still the 3 main ways that a person can become infected with COVID-19 in the state of New Hampshire. And yeah, so we do all the contact tracing at the health department, and I'm doing it now, and it's fun.
So is that's in the state of New Hampshire. Do we do anything nationally or anything globally for tracing?
I'm not sure about that. Bobbie, do you know anything about them?
Yeah, so pretty much what we have employed in our state and across the country is we use the same type of activities for contact tracing and contact investigation, where there's I want to say aggressive, but the CDC does recommend identifying those who are positive, and then tracking those individuals so that you can see who all else may have been exposed to that individual. And so the model that we use is one that comes from the CDC with regards to how we're tracking. People are using different tools. So for instance, in New Hampshire, we've just started using a tool that's called Salesforce, which allows for, once a case is identified in the labs, it's reported through a reporting system, our New Hampshire epidemiological database that we call NEDS. And so we do our tracking and our surveillance through that system, and through Salesforce, it allows for us to have as many people as we can do the investigations on those positive cases as they come through, and then allow for us to assign individuals for tracing or tracking their contacts as well. And so that's a new tool for us. And basically it allows for us to be more expedient and move faster through identifying those positive cases and tracking those individuals. And Salesforce has been implemented in a number of states, and then other states are using all types of different tools, but pretty much the same type of activity is happening across the country. As far as what they're using globally, there may be other tools, but the idea is, again, to identify your index case and as many contacts or exposures to that case to get individuals, on isolation or quarantine, so we can slow the spread and stop the spread of the infection.
Great, thank you. Okay, our next question comes from Amy. Since there is no cure for the common cold, the virus, what is the chance of finding a cure for this virus?
I will attempt to answer this.
Thank you.
Simply because I think right now, because we're still in the response phase of this emergency, I think the idea that we could develop a cure for this at this time, in a time that would actually be protective of the community, is relatively limited. I think what we can expect, because we are in a prolonged state of emergency, there being 4 stages usually to emergency management, preparedness, response, recovery, and mitigation. And currently we're in a prolonged state of response. The idea is to minimize the proliferation of the disease, where we can limit the surge that would overwhelm the hospitals, that would aggravate the ability to tend to ongoing conditions that are already existing in the community. So I think the chance of finding of a cure in the short term is relatively small. And I think, honestly, given that it's still in the mutating phases, because it is still shown to be mutating, that the goal is to limit the proliferation into the community more than it is to develop a cure, so to speak. More so, it's a vaccine that would allow people to withstand the onslaught of the viral infection if it should occur. So I think the question should be rather what we can do in the short term to prevent this from spreading at the rate that it is spreading. And there are lots of known, albeit simple, steps that we can take: washing your hands, not touching your face, social distancing, staying home, avoiding unnecessary trips out. For folks who are in vulnerable populations, taking added measures to mitigate the risk, meaning wiping down your groceries when you bring them home, although there is a very low risk of the transmission via groceries. Making sure that anyone that you're coming into contact with or is wearing a mask, that mask, if it's cloth, is washed after each visit out, and maintaining a vigilance that requires a level of attention and cognitive load is not necessarily normal to most people. Anybody who lives with a chronic disease would tell you that this is the world that they live in. Folks who are immunocompromised tend to have a level of vigilance that the rest of the community doesn't have. And this is more of a familiar engagement than for the rest of us, but we still need to maintain that vigilance, and that vigilance will allow us to restrain the proliferation of the disease. But at this time, hoping for a cure is, not reasonably possible in this time frame, but maybe eventually, as we move past the emergency response towards mitigation and potentially back into the preparedness situation, where we're trying to find ways in advance to limit the spread of novel diseases as they emerge.
Yeah, and I'd like to add on to that as well, because some of the curative measures, if we want to think of them as in a non-medicinal way, would be some of the behaviors that we have. And so, for instance, Jenn talked about the things of the mitigative factors that we have in place with the social distancing and wearing of the masks. There are other things that we can do, which we've talked about in public health very often and all throughout the year, even before our novel COVID virus came on the scene. And that is, when individuals are sick, that they really need to stay at home. And so if you have a fever, or if you have diarrhea, if you have those types of things that let you know that there's something going on in your body, you really want to stay out of the public and stay out of the community and stay home. And so what we have to do is adjust our behaviors and even our attitudes around that to allow for people to be okay with staying home while they're sick, to allow for policies to be in place that allow for individuals to take sick time and not feel guilty about being out of work or being sick when they are. And so the other thing that we're looking at is, hopefully, like we have with some of our other respiratory infections or other childhood preventable illnesses, that the onset of a vaccine coming on board will help prevent the spread of this infection. And so some of those measures that we can take are very simple ones. The washing of the hands, as was mentioned, the not touching of our face, our eyes, our nose, and our mouth. And I would really say, when people are sick, to really keep themselves out of the public so that they're not exposing others to the virus that they're carrying. And that can be curative.
Great, thanks. Okay, the next question is, what percentage of New Hampshire has been tested? And what's the difference between the PCR versus the antibody tests? And Bobbie, I think we could probably follow that up logically with the testing and data analysis that you've done ahead of time. So we can show your slides at the end of the answer to this question.
Sure, and I'll let Angela address the percentage that has been tested. She's our data guru, and we do this daily presentation of information to our joint partners at the hospital, fire, and police, and so she has that information. And then we can talk about the PCR and the antibody test. Great.
Sure, yeah. So in the state of New Hampshire, as of today, about 52,000 people have received the PCR test. So that's about 4% of the population of New Hampshire. And then about 7,000 people have received the antibody test. So the difference between PCR and antibody test is PCR is a viral test that tells you if you have current infection, and that's the nose swab. And the antibody test tells you if you had previous infection, and that's a blood test. Antibody tests are not typically immediately useful for diagnosing acute current infection because antibodies are made about 9 to 11 days post-infection. The good thing about antibody testing epidemiologically is that it can show us in total how many people have had the disease. So we can look back in time and we can say, wow, a lot more people were sick than we originally thought, or a lot less people were sick than we originally thought. And it's also good to identify, if someone has the potential of immunity. We're not sure right now if antibodies do mean that a person's immune, but if they are, then the antibody test would be able to tell them that.
Yes, and as we can see from this slide here, it allows for us to see the onset of IgG and IgM production in our bodies when there is acute illness, and then when the onset of the IgG comes on to help with the antibody production with regard to, as Angela mentioned, being able to identify exposure to the disease where an individual their body may be mounting some immunity to it. We're actually hoping that like with so many other diseases with IgG production or the antibody production, that this happens with COVID-19 as well, because then when that does occur, it means that the individual may have some immunity when this virus comes back on the scene. Again, our bodies will recognize it and respond to it in a way that does not allow for us to be sick. With the PCR testing, which is the rapid test, if we collect a well-collected nasopharyngeal swab, we know that, from a newly symptomatic person, the rapid PCR test has a sensitivity of about 97% with 100% specificity, which allows for us to know the accuracy of these testing tools that we're using. And so the information helps for us to understand what the disease burden looks like in our communities and in our state, and also allows for us to know what type of activities, what type of measures, the mitigation measures we need to continue to have in place to reduce the spread of the infection. And the more we have antibody production or people mounting that type of immunity, it allows for us to know or have a greater sense of herd immunity, which allows for more people to be immune to it so that those that are most vulnerable can be kept protected because of that response in our bodies.
Okay, that was actually leading right into the next question. And what is herd immunity?
I was hoping to clarify something first for those who are not in public health, the definition of sensitivity and specificity. So Bobbie had mentioned that an important point of whether or not you can trust a test, and sensitivity and specificity is one way in which researchers determine that. And just briefly, the definition is that when the sensitivity is the ability of the test to identify those with the disease, true positive, so of who are taking the test, do they actually have the disease or not? And specificity is how accurate the, if you get a negative diagnosis, is truly a negative diagnosis, so the true negative rate.
And I want to add on to that too, with the PCR test, the specificity is largely determined by the sample that's collected. So if you do test negative on a PCR test, it's possible that you were tested too early or too late in your disease progression to have gotten a positive result. So in that case, you would need to follow up with an additional PCR or an antibody test to confirm illness if you really thought you were positive and you tested negative on a PCR.
And there's another piece to that we've been seeing with individuals that have been doing follow-up testing, is that the viral strands can still be in a person's system, even though they're weakened or maybe even dead. They may actually show up as a false positive for an individual who's had the infection for over a period of time. It may even be 21 days later that test is still coming back positive, but that individual may in fact be non-infectious, because no, you can't. We've learned that the virus won't continue to grow out in culture past 9 days. And so a person that may have tested positive, if they wanted to have a confirmation test, because we're learning some places of employment want them to have a confirmation test of their negativity, and some of those tests 2 weeks or even 3 weeks later are still showing positive, but that person may no longer be infectious. So there's a lot that we're learning about, this infection. There's a lot that we're seeing with this, with the testing. And what we want for people to do is just maintain, again, back to those basic things, the social distancing, the hand washing, wearing of those face masks to make sure that they can reduce exposure and reduce their contact to the virus itself. And there was a question about the herd immunity. Herd immunity occurs when as many people in our environment and around in our, in our communities or in the population are protected against disease through vaccination. And so there are some that have factors or reasons why they may not be able to get vaccinated. It may be because the vaccine may be more harmful for them because of some of the ingredients in the vaccine or a reaction that they may have to some of the ingredients, or it may be a religious exemption that they have. But when the majority of the population is vaccinated, those who have not been vaccinated are protected. And so when we think about COVID-19, as many as are infected with the virus and are recovered and mount that the antibody production that we want to see, the majority of those individuals helps also protect those who have not been infected as of yet.
Okay, so that brings up two more questions.
May I add one extra thing? If that's
please,
okay?
Jen, go ahead.
I just want to augment Bobbie's explanation of herd immunity. Just to address a component that has been somewhat popularized on the internet, which we know is questionable methods, and we're speaking about viral misinformation,
Yeah.
pun intended, that you can also achieve herd immunity through natural illness progression. And some people are advocating for this erroneously, based off of experience with previous viral infections, namely come to mind thinking about the chickenpox parties that people used to have to get their kids sick and get them through it, and then they would become immune to it. What's highly problematic and dangerous in this realm is that we don't understand what exactly are the mechanisms that kill certain populations and don't kill others. And so it's really playing Russian roulette to allow this virus to proliferate through the population in a way that's unmanaged and unmitigated. Yes. So because we can't predict, and because seemingly healthy people decompensate relatively quickly, and there's a series of events that can occur biologically that either cause a suffocation through the lungs or a cardiac event or any number of other complications. This is something that is incredibly dangerous. And the expectation with COVID is that about 70% of the population would have to be infected before we would achieve herd immunity. Lending back to what Bobbie and Angela had noted about the antibodies. So when you have illness, you develop antibodies in response to that, and those people who survive it would be considered immune. And that's the other piece, is it's unknown how long you have immunity to COVID once you get it. So there are other viral infections, namely one I've had many opportunities to deal with personally is when people get, what's the I'm blanking on the name of it, but it's like it's a gastrointestinal issue where you can get it multiple times. You have immunity for like 6 months. So this happens because I work in a hospital, norovirus, excuse me. So I work in a hospital. And so every winter there is exposure because we have shared bathrooms with the patient population and the public. And so you get about 6 months immunity from norovirus and can be exposed to it again and get sick. And what we don't know about COVID is if how this infection, how virulent, how long you stay immune to it. So developing herd immunity naturally is very dangerous and not recommended. So that's why there's such a push now to develop a vaccine, which, in normal times can take years to do. And there's an expectation that we won't see a vaccine that is well studied, because that's the other thing. When you do studies on vaccines, they're done in very hygienic, specific populations, and then you release it into the wild and see what it does. So we won't know for at least 18 months to 2 years whether or not a vaccine will be effective for a particular strain. Again, as I had mentioned earlier, COVID is still mutating. So just wanted to augment that so people don't get the idea that having a COVID party is a good idea. You are putting their life and other people's lives at risk.
Yeah, and that's so important, Jen, to to bring that to the forefront of this conversation, because what we have been finding through some of our disease investigation, when we learn about positive cases, is that some people have such mild disease that they don't take it as serious because they haven't had the health impact that we've seen in others, right? And so some people's disease is so mild, they don't even have fever. Some people don't even develop cough. And as you mentioned, but that doesn't mean that another person who comes into contact with them won't have, a worse condition because of how their immune system responds to this virus, because this virus actually can hyperstimulate the immune system to where some people end up, as you mentioned, having suffocation of the lungs, because the virus tends to love our alveoli. There's a certain receptor on the alveoli that they try to get to. And so different individuals respond to this disease very, very differently. And so I want to reiterate what was said about, don't have the COVID party because your disease was mild, because it could be detrimental to someone else in your family or in the community. And that's why we want people to take the mitigative measures that we're putting in place right now around the social distancing, because we've seen in the population of individuals over 60 that have comorbidities, meaning that they have other underlying health conditions, how bad that could be for those individuals. And so we want everybody to think about their own personal and social behaviors, being mindful that we are keepers, of one another's. We're brother and sister keepers of one another. And so we do all the things that we can do to be vigilant about preserving the health and well-being of our neighbors. So thank you, Jen, for that.
Yes, thank you. Okay, the next question is from Courtney Wood, whom I know is in San Francisco because she is my lovely daughter.
Oh.
And she would like to know, as businesses open up, how should we decide what activities are safe to go to?
Bobbie, do you want to lead?
Sure. Well, that's going to vary from activity to activity, right? And so anything where there are large numbers of people that are gathered together, we want to avoid those types of situations. Activities that involve lots of social distancing outdoors, activities that involve as minimal touching and handling of objects and things, as well as things that are safe to do. Say, for instance, the golfing has opened up, and so golfing is going to be low risk. Going out, the retail establishments have opened up. And so when people think about going to stores, you want to, again, think about social distancing. You want to make sure that you're wearing your mask when you go out, and that you're keeping your hands in particular clean. Lots of hand sanitizing and washing your hands as often as you can, because everything that we touch allows for the virus to hop on and take a ride. And when the virus hops on and takes a ride, we have so many social things that we do, and our hands are on our faces, on our mouths, and on our nose. We want to make sure that we avoid a lot of that behavior. Other things, going out to eat. We're hoping that our restaurants will maintain as much social distancing space as they possibly can. And so there's policies in place with how they can do that. And outdoor dining is what we're encouraging, to keep people out as much as they can be out, so they're not enclosed in settings. Activities that involve anything that has to do with touching and handling and exchanging objects is what we want to really try to avoid. Going into hairdressers or hair salons, again, making sure that you have the appropriate protection on your mouth is important. And again, washing your hands, that's going to be the biggest thing for us in reducing the spread of this infection. And so, we want for people to be really mindful of the activities that they get involved in as businesses open, and think about how much transmission can occur with the different activities that they are actually engaged in, they participate in.
That's so great. May I add to that too?
Sure, please.
So I often get asked this a lot, simply because of the nature of the work I do in public health, but also I'm a moderate to severe asthmatic, and I've been taking precautions that would mitigate my risk, and that's. So Bobbie mentioned two elements of this. We need to mitigate our own risk, and we need to mitigate the risk of those around us. That is something that is, we live in an interdependent society. We are learning this quite deeply with the profound economic effect that this pandemic is having on us. I am a moderate asthmatic. My husband works in a hospital setting and is an essential employee. So he's been having periodic tests to, see of his status to make sure that he's not unintentionally infecting us and others. I can say, as a moderate to severe asthmatic, I do many things. Make sure I take all my medications. Also, I don't, because we have an added risk factor in our house where somebody is actually in a hospital setting and coming home every day, we have almost no contact with anybody else outside of our family, because for two reasons, for those reasons Bobbie had mentioned, the risk to me, but also, should I be a person, despite my moderate to severe asthma, ends up infecting somebody else? That's something I feel adamant to guard against. So one of the things I want people to be mindful about while you're out in public is that it's easy to forget that we are in the middle of a pandemic, just by the sheer excitement of seeing other human beings. So as you get to doing your normal activities, it'll be very cognitively challenging to keep in the forefront of your mind that everything that you touch is putting you at risk or somebody else. So you're out at a restaurant, you're 6 feet apart, maybe you're having a couple drinks, you forget, you see somebody walking down the street, you immediately want to grab them because it's been forever, and why wouldn't you want to? But the idea is to not forget. Don't forget that we are still in the middle of this crisis. The cases are still rising. We have to balance the economic impact of this pandemic in a way that allows us to minimize the surge at hospitals, minimize the impact and death, while also resuming some form of economic normalcy. So those are real challenges. Just don't ever forget the primary challenge, that life, any life, is worth all the measures, and you are in the center of that, and every activity you make, first with yourself and then with others. So if you're out, make sure you really need to be out, and make sure that when you're engaging with others, you're engaging with them as though you have the potential to kill them, because that is very true.
Yeah.
Oh. Okay, well, thank you for that excellent answer to that wonderful question from Courtney in San Francisco.
Courtney.
Next. An interesting question. Why are children getting sick with different symptoms than adults?
So I'll take a stab at this question. So I think there's two different tiers here. So there's children who are experiencing very mild symptoms, and then there's children who are experiencing concerning symptoms, the Kawasaki-like disease. So I think that I just want to say that the vast majority of people under the age of 18 are experiencing mild symptoms of COVID-19, which makes sense because you think of adolescents as young and healthy and easily overcoming respiratory illness. And then there's the other concerning piece of the Kawasaki-like disease. And Bobbie, I know that you're interested in that. I don't know if you want to talk about that at all.
Yeah, the main thing with the Kawasaki's disease and, what they have seen and what we've actually seen in some of our investigations with children is that, it's very interesting because with some of the kids that have actually demonstrated this multi-system, inflammatory disorder that the kids are seeing is that they may actually test negative with the PCR, that rapid PCR test. And then when they have the antibody test done, it comes back positive. And then they start to develop signs and symptoms with a rash, headache, stomach ache, so gastrointestinal pain that comes down the line, and it can be sporadic. But when all of those things are there together, parents have to really watch, their kids for these signs and these symptoms. So if their kids start complaining of a headache and it's a severe headache, and they complain of their stomach being upset or having stomach pain, or they just seem a little off, we really want parents to pay attention to those things and make sure that they let their pediatricians know. Initially, when the virus first came on the scene, there was a lot of this thought that, kids were immune and that maybe they were, carriers of the virus because they weren't showing a lot of signs and symptoms. But even the mildest, some kids have lost their sense of taste and smell. And it wasn't really thought of initially as this was a part of COVID-19. But now we found that there's quite a few individuals that lose that sense of taste and smell. And so this is thrown into the category of these are some of the signs and symptoms of this disease. And so with the children, we really want to pay attention to some of these milder things, but then also look at these other signs and symptoms as well to make sure that that kid is not getting to the point where they are going to show, that Kawasaki's, which is when the rash, comes up, or some of these other symptoms and signs. So pay attention to those things because it can be really serious for some kids. And some kids, again, they recover from this, but kids that have immune compromised systems like lupus or other chronic diseases that they're living with, maybe those kids that kind of tip over the edge with this. And so we want people to be vigilant about it, including our providers, the healthcare providers. So for the investigations that I've been doing with parents, when I ask them different types of presentations that their kids have, and they tell me that they've complained of headache and they've complained of stomach ache and they've seen a small rash, I tell them immediately, make sure you call that child's pediatrician, make that pediatrician or make that provider aware of these symptoms so they can continue to monitor the child to take the measures that they need to immediately if it gets worse for that child.
Great.
I'd like to add it. Can I add on to that? This is so great.
Yeah, please,
So
Jenn, go ahead.
I'm just going to take this as a learning opportunity as someone who's currently in the mode of faculty. And also, I think this would be really helpful for people to understand the difference when they're starting to parse through information that they're finding online, which is prolific, right? I mean, let's be real about that. And it's very hard to determine which information is real, how to dissect it in a way and make meaning of it that may or may not apply to your life. So the presence of this childhood syndrome has shown association with the progression of COVID. So something that Bobbie noted that I want to draw attention to is that some of these children are testing negative for COVID. However, symptomatically and also geographically, the spread of these diseases are aligned in such a way that it lends itself to association. Now, association is different than causal. Causal is the direct link to one agent for producing a certain outcome, and that can be shown statistically and biologically. And right now, because scientists don't know and can't say for certain whether or not this childhood syndrome is a direct result of COVID, they are taking precautions and treating it as though, because the associations seem to be strong, that it is likely tied to a biological process associated with COVID. So when you're parsing through information about things that are unknown, ask yourself, is this a causal relationship? And causal is typically paired with scientific numbers. Angela can talk to you about all the numbers associated statistically with causal relationships, or association, meaning that, one thing is associated with another thing happening. Now, association is subject to all kinds of biases, right? A lot of it is confirmation bias. Oh, it was sunny on Tuesday and I got a cold on Tuesday. Every time it's sunny, I'm going to get a cold. Well, that's not true. So only through careful scientific examination could you determine whether or not that was by random chance or that it was truly tied to a biological underlying relationship. And so oftentimes we see that language in the media, and it's confusing because they are treated as synonyms when they are not. So when you're looking at information that comes out, oftentimes from scientists, you will see there's left a little bit of vagary in the language. This may likely lead to, this may be a form of la, la, la. And that careful, cautious language is because you don't know with certainty whether or not that is truly tried. But in this circumstance, there are so many associations, like Bobbie noted, the lack of taste, the overwhelming of the cardiovascular system, which there is an element of that with COVID as it progresses, particularly once you've been intubated and hospitalized. So it's really important when you're working through the information to ask yourself, is this a causal relationship or an association? With the childhood syndrome, right now it's a strong association, but it's not determined to be causal just yet.
Okay, great, thanks. The next question is about nursing homes. Nursing homes in New Hampshire have been severely impacted. What changes should we make going forward to ensure these facilities are not as vulnerable in the future?
That's a tough one because that is a very high risk population, both with the staff that works in the facility, being the healthcare workers themselves, and with population that lives in or that reside in nursing home facilities or assisted living facilities. You look at the age group, it's over 60. You look at the other factors that are contributors to the impact that we've seen in the nursing homes with the comorbidities or other underlying health conditions once we get to a certain age. For the most part, individuals that are in nursing homes, if they're not leaving, what you're seeing is the folks that are coming into the facilities can be the vectors that are carrying, they're walking fomites carrying the virus on them. And so they have been severely impacted. We've seen, I think if the data is still correct, as still the same as it was when we initially got into this event, over 3/4 of our infections were related to what we were seeing in our nursing homes. And we've had continual outbreaks in some of our nursing homes, again, because we have people that are coming into a lot of community acquired infection of our healthcare workers can be brought into those settings. And so when we say, what are the changes that we can make going forward to ensure these facilities are not as vulnerable in the future? For the most part, as soon as we can get the vaccine, that's going to be the key. People have been working really, really hard with their use of personal protective equipment, which is the mask, the face shields, the infection control gowns, the hand washing. All of those measures can be in place. And all it takes is for that virus to come in on one, and then that one go from one part of a unit to another part of the unit unknowingly carrying the virus is where we're seeing the impact in these nursing homes. And so we've been working very closely with the nursing homes in Nashua. We've been hearing how they've been as vigilant as they can. We've had a slow onset of outbreaks, in Nashua. And sometimes people are doing all that they can, and it's like, well, how did this happen, and where did this come in? The asymptomatic spread is something that we really have to pay attention to, because sometimes, again, people don't have signs and symptoms. And so the vigilance around that personal protective and keeping that vulnerable population group as safe as we can is what we're going to have to do as best as we can. But until vaccine comes along, we're going to have to work really hard to protect that population.
Okay, thank you. Now we have another question about the masks. How effective are the masks? And with so many types, what should we be looking for to buy a good one?
So there's 3 types of masks. We have N95s, and then we have medical grade surgical masks, and then we have homemade cloth masks. So the N95 masks are, the reason why they're called N95s is because they can prevent 95% of particles from going through them. These are for healthcare workers who are in high-risk aerosolizing procedures in regards to COVID-19 to prevent aerosolized particles of COVID-19 entering into their mask. So then the surgical masks, the medical grade surgical masks, are similar to the homemade cloth masks. So the homemade cloth masks are kind of like a dupe of the medical grade surgical mask. And this is a cloth covering that protects other people from your potential respiratory droplets. So if you're asymptomatically or pre-symptomatically transmitting virus, then wearing a mask protects other people from your respiratory droplets. So in the event that everybody's wearing a mask or a homemade cloth mask or a surgical mask, then everybody is protected from respiratory droplets because everybody has the mask on. And so they're all protecting their own cell from everyone else from their own droplets.
And I wanted to share some information that our mayor in Nashua actually talked about today in a press conference that we have for Nashua residents. And, the question was, how much can we reduce the transmission rate with masks? And as Angela talked about the 3 different types, this particular information comes from Thomas Mayo, who did an analysis that calibrated the intervention and contaminants of COVID-19 pandemic. That's in a study by Luang, Tian, and others. And what they found is that if 60% of people wear masks, that are 60% effective, that it's enough to control the pandemic. And so if it's the cloth mask, the surgical mask, or the N95 mask, if we're wearing those and they are at least 60% effective, that helps us to control this epidemic. And if we can get to that level of use in our communities, we will see a huge decrease in the spread of this infection. And so they are pretty effective if we wear them the appropriate way. So meaning, because wearing your mask, right, is not enough to protect you if your hands, I'm going to just talk about these lovely hands. If these hands are touching our face, touching the mask, touching our eyes, and if you're wearing the mask here instead of here, right? It's not going to do what it's supposed to do, but we got to make sure that we wear the mask appropriately. And then we make sure that these hands, we don't give ourselves a false sense of security because I have my mask on and I'm protected. We have to do all those other things too. The mask is useful if you can't maintain that 6 feet of distance from someone. Make sure that you have that mask on. And when the mask is on and it's on appropriately, don't touch it. Don't move it. Don't move it around the back of your neck. Don't put it up on your head. Don't pull it down like it's a necklace. Wear the mask appropriately and make sure, again, that these hands are kept clean at all times. That's when we see the most effectiveness of the use of our mask, whether it's cloth, the surgical mask, and N95s, which the public doesn't really need to have N95 masks on, but definitely have on that face covering when you're out in the community and can't maintain that social distancing of 6 feet from your neighbors and your friends.
Okay. Jenn, you had said you wanted to talk about the psychological and the mental aspects of all these restrictions. Would you care to comment?
Yes. So this is something I think is incredibly important as we begin to think through how we engage in the community, what this pandemic has been doing to people in terms of their mental health, their sense of isolation. I've seen some recent work studying the impact of fatigue. So I had mentioned earlier that there are, commonly understood 4 phases of emergency management, preparedness, response, recovery, mitigation. And these tend to cycle through one another. And, when we think about most of the emergencies that we are used to, at least here in New Hampshire, they tend to be relatively short-lived. They can be highly impactful, thinking of, the tornado that touched down on the seacoast, or major power outages due to, natural events, whether through thunderstorms or through snowstorms or ice storms. Most of the response phase is relatively short in comparison to the pandemic. And then people enter into a recovery phase, getting the power back on, making sure that, during the floods of 2011, for example, repairing bridges and dams, rethinking where we, build, things along, unsafe structures along the river. So when we think back to most of the emergencies that we are accustomed to here in New Hampshire in particular, we tend to have this mindset of we can suspend daily operations for a week at most. Even then, people get pretty, fidgety and restless at home without, electricity. But this pandemic is different. It's prolonged. We are actually still in the response phase. We are mitigating some of the unfolding. This is why we saw the early and strong measures being taken to restrict, social engagements, large groups, to prevent a medical surge in our healthcare settings, so we can make sure, as this some of the unknowns associated with the virus are overwhelming our healthcare systems. But now we're entering into a phase where we're starting to see some of those measures be relaxed, and we are like a bunch of horses at the gate ready to go, because we're all tired. There's a psychological fatigue to it, and the fatigue is natural. And, we see this in prolonged chronic health disease, public health measures. There's a short-term cost. You're like, well, I could eat this cheeseburger because what's the chance of me getting a heart attack at 55? I'm willing to take my chances because right now I've had a hard day and I just feel like eating a burger with fries. Well, in this circumstance is greatly magnified, right? That short-term cost associated with a long-term benefit. The social distancing, the social distancing works. It's a very simple measure, but it's very powerful. If we don't interact with other biological organisms, we're simply not going to spread the disease. Well, when we socially constrict this way, it has an impact in our sense of belonging. It has an impact on our sense of spatial orientation, so this has an impact on our sense of safety and territorialness and a whole host of other psychological components. So once we get the opportunity to start to look like we're going to resume normal, people are feeling the need to do that quickly. Some of it is due to, serious and dire economic consequences associated with these early public health measures. And I say early public health measures, life-saving measures. But we need to remember that cases are still going up. We still don't have any certainty about the pathophysiology of COVID. And so we need to continue to engage in that way. We also need to remind ourselves that it's normal to be anxious and want to return to what we have considered our previous normal, for a sense of psychological safety. Unlike chronic diseases that we may or may not engage in behaviors that put us at risk at a further time, with COVID, we don't really understand the mechanisms that lead to these health outcomes. So the ability to have the conversation with yourself about, what the real need is it a psychological need to feel normalcy? Is it a psychological need to feel in control? And ask yourself what cost is associated with that. Is the cost that's associated with that the potential I could make myself or someone else sick? And that's real. That psychological impact is very real. It's also something to be mindful of and to draw your attention to, that you're actually putting yourself and others at risk through this fatigue.
Great. Well, thank you, Jen.
I was going to have to say, just add on to that.
Touch my face. I'm sorry.
We do have people that experience, a great sense of loss because of that disconnectedness. And so some of the messaging that we, put out is around, being separate, but remembering that we're still here together. We still want people to be hopeful, doing things like this where we can use technology to our greatest advantage, where we can actually see each other, and we may not be able to physically touch, but we can connect emotionally through some of these ways that we're communicating very differently. And so we want people to, write a letter, write a note. Remember snail mail, remember postcards, do some of those things to help people feel connected and that they're not forgotten. Doing the telephone call and not just texting, but reaching out and hearing somebody's voice. All of those things help with that, that fatigue of that psychological feeling like I'm alone and I'm separated. Because we are creatures we like to be together, right? We like to touch physically, and we like to, show our, love towards one another by doing some of those things, and some of those activities and some of those behaviors can actually be harmful for right now. So how do we overcome some of that? We have to think about, how can we bring hope, in a different way? What are some of the other activities that we can do that can help people feel like they're a part of something in a way to be connected? And people have been really, what's the word I want to say? Really creative in how they've done that and how they've reached out, to each other and doing different things like the drive-by, like birthday shout out, from the car, or showing up outside of someone's house, or just doing like little deliveries. There's a group. In fact, our Rotary has reached out to us. We're all on lockdown. Like no one can come into our building. We're providing services in a very unique way. And they decided what they would do is they would drop us off lunch. Can you imagine that? And how that made us all feel to be able to get something special, or being thought of in that way. So the mindfulness piece is so important. But as Jenn said, there's a whole psychological aspect, to this that we have to help each other overcome. And I'll say it again, we are each other's brothers and sisters keepers. And because we should be reaching out to one another and making sure that we can help people be hopeful that we are going to come, to the other side of this. It is going to end. We purposefully and intentionally flattened the curve of this to extend it out longer because we were really trying to be protective of our hospitals and our healthcare personnel. If we had spiked up with a high rate of infection really, really quickly so we could get out of this quickly, it would have decimated our hospitals. We would not have been able to handle this at all. So we flattened the curve intentionally with extending it out just a little bit longer so that we could handle what was happening in our state. And in New Hampshire, we have done very well when we think of some of the other states that are surrounding us with how we have contained the spread of the infection. We have lost, some lives, and that's very hard. And one life is hard to deal with how that impacts a family and a community. But we've been able to keep that loss low. And so we want to encourage people to continue, to work with us in public health, to work with their healthcare professionals, to work with their families, to be mindful of those populations that are the most vulnerable so that we can protect them. And we will get to the other side of this together.
Great. Thank you, Bobbie. So we've gone over our allotted time, but we want to try and squeeze in one small, quick last question. Where can we go to get accurate and timely information?
You can, to get accurate and timely information, you can go to our website at nashuanewhampshire.gov/COVID-19. We have links to the CDC's website and New Hampshire DHHS's website. We also have a link there to our data dashboard, and our data dashboard is updated every day with new case counts, testing information, what we're doing at the city of Nashua, and all kinds of different information. We also have information on that website about resources available. We have a quarantine guide with things to do with kids, things to do outside. So we have a lot of great resources on that page. So check it out.
We can also send out information through our constant contact list. We send out a daily update on the latest information that's coming out through the CDC and from our state health department on types of health alerts, all type of information for healthcare providers, for families. We also keep people informed of things that, are a part of our normal everyday. So we want people to remember about other protective things that they need to do for their health and maintenance of their health. May is Mental Health Awareness Month. So we push out information about that. As Jenn talked about, this whole psychological aspect of COVID-19 and living in these times. So we push information out on that. And so our constant contact, if you go to our website or if you contact us through Facebook or through our emails, and I don't know if a screen's going to pop up with that information about our emails, but I'm Bagley B@nationalnh.gov. Angela is Consentino A@nationalnh.gov. Jenn, give your email address as well, but you can contact us and we will make sure that you also can get accurate information from us as well. And we would love to include you on our constant contact list to get that daily information out to you as well.
And I'd just like to broaden it out from Southern New Hampshire to New Hampshire and beyond, since I noticed that we had asked where folks were coming from, and we have people from all over the country. It's fantastic. So if you want reliable and accurate information for New Hampshire residents, you can go to the New Hampshire Department of Health and Human Services website, www.newhampshire.gov/COVID-19/. That website is updated daily for the cases up until 4 o'clock the day before. They have a map to show you the geographic spread, although that is a case count and it's not normalized by population, so it looks like the spread of the population. You can also, I tend to, when I'm looking for information, I will go to the National Institute of Health, which is www.nih.gov/health-information/coronavirus. There's a wealth of information there. Also, you can go to the CDC. That is a reliable source of information, not just about managing symptoms, but populations with comorbidities, as Bobbie had mentioned. And then if you're looking for economic assistance in New Hampshire related to COVID and COVID type stuff, you're trying to file insurance, things of that nature, you can go to New Hampshire's 211 number and call to be redirected to get assistance for, and if you're experiencing an economic outcome from this, also about questions related to testing in New Hampshire. And then I also, just because I'm a big science dork, I spend a lot of time on PubMed. PubMed is I love it. I love to get into the weeds. I look at the case reports of what's happening with people. It's scary, terrifying. And if you want a reason to wear that mask out in public, go ahead and read some of the case reports. It'll put chills down to your bones. So PubMed is a online literature review. And like I mentioned earlier, there's a proliferation of COVID-related resources that some are disease specific. So if you have a comorbidity, like diabetes is one that is being studied currently now. We are aiming to apply that towards cancer care research and the impact on cancer patients, but you can find a whole host of that information on PubMed.com too. .gov. So those are some of the reliable resources that I go to.
Okay, great, thank you. One last comment to one of our listeners. Courtney in San Francisco called your dad. And then, so for the Science Cafe, you can see it takes a great audience with some good questions, and it takes an outstanding panel to make these things work. And we had both of those tonight. So please join me in thanking the panel for both their expertise and their time. Great job, really great job. Thank you.
Yeah. Socially distant, not socially disconnected.
Exactly. Thank you so much for having us.
Thank you. What a treat.
Great. Thank you so much.
So there you have it. The first virtual Science Cafe in New Hampshire is complete. Thank you for taking the time to join us, and you can always share this video with your friends who couldn't be here. We invite you to support Science Cafe New Hampshire by making a donation through the vehicles listed below. Even virtual events take funding, and we appreciate your support as we experiment, evolve, and work to keep the Science Cafe community informed, engaged, and healthy. Please be safe, and until next time, remember you can join our email list at www.sciencecafenh.org so you'll always know when the next virtual science cafe will be, where the beer costs less, but the service varies. Be safe.